Welcome to this video on how to perform a thorough skin assessment. Performing a thorough skin assessment is the most important part of wound care and wound care prevention. I am going to break down how to perform a thorough skin assessment so that you are not held accountable for anything that is missed. When you do a skin assessment, you want to follow the head to toe rule. You perform your skin assessment from head to toe. You also want to break this down into groups to make it easier for you to remember and also to ensure that you will not forget anything during the skin assessment. So you're going to break it down into head and neck, trunk of the body, groin and buttock, arms and legs, feet, toes, and heels. When you see a patient, the first thing you want to do is start at their head. Always look at their scalp, look inside of their hair, make sure there aren't any scabs, any lacerations, or any wounds, open areas, broken skin, or anything like that in the scalp. You want to take your hands and feel for any lumps or bumps that you may feel and take note of that. Next, you're going to move down to the head. I always start with the ears. You want to look behind the ears. Make sure that there aren't any sores here in this area, especially in your patients who wear oxygen, the nasal cannulas. They can be very, very harsh on the ears. So you want to make sure that if your patient is wearing a nasal cannula, this is not a step that you ever skip. These wounds can create very quickly and go bad very quickly. Next, you're just going to look at the general appearance of the face and make sure that there's nothing on the patient's face, no broken skin, no rashes or anything like that. And then you want to look inside of the patient's nose. Use your pen light to shine inside of the nose and make sure that there aren't any scabs or sores within the nose of the patient. The next thing you're going to do is look at the patient's mouth. You want to really be thorough about this when it comes to patients who wear dentures. Always ask the patient if they have any dentures, whether they're full dentures or partial dentures. Have them remove the dentures and open up their mouth. You want to pay attention to the roof of the mouth and the gums. Once you put the patient's dentures back into their mouth, you want to make sure that they fit properly. And this is important because ill-fitting dentures can cause sores and will cause sores. These are all things that you want to take note of when observing the roof of the mouth and the gums of the mouth. You're also going to take a look at the patient's tongue, have them lift it up really quickly, look underneath the tongues and make sure there aren't any lesions. When assessing the trunk of the body, I always start with the back. Just look at the overall appearance of the back. Make sure there aren't any open areas or any scabs or anything like that that needs to be noted, anything that is out of the normal. Then I move on to the chest and do the same thing. Just look at the overall appearance of it. If you are assessing a male and his pec muscles are bigger and he has folds, you want to look under those folds and make sure that there is not any moisture present or a rash present. If you are assessing a female, you want to do the same thing. Females are more prone to moisture collection, which leads to a rash, especially if they do not wear a bra. And then some women tend to get sores in this area if they have a worn down bra with wires that have created a sore or dug into the skin. So that is something that you always want to make sure that you assess when you are doing the trunk. Next, you move on to the abdomen, and the abdomen pretty much is just the overall view as well, making sure that there is nothing out of the normal present on the skin of the abdomen. If the patient has a bigger stomach, you do want to lift up the stomach and look underneath it for those same reasons, making sure that there is not any moisture present or any rash. Under the stomach and under the breast folds is where fungus tends to thrive and develop very quickly in patients. So you want to make sure that you're mindful of that. Next, you're going to assess the arms and the legs. And this part is pretty straightforward, or at least you would think it would be. The biggest thing that you would want to pay attention when you're assessing this part of the body is to pay attention to your pressure points. So you want to make sure that you assess the elbows and the knees. And for the knees, that includes the front and the back of the knees and the inner parts and the outer parts of the knees, because these can create sores, especially in our patients who have limited mobility or have no mobility at all. If you have a patient whose hands are contracted in this position or in any other position, such as this one, you want to make sure that you look in between their fingers and check for any skin breakdown, check for any moisture that is starting to create, because unlike under the breast and the abdomen, when moisture creates in between the fingers and the hands, it opens up sores and it doesn't create a rash. Also, if you have a patient whose hand is contracted like this, I have seen where the fingernails have grown, and because the patient cannot move their hand and no one assess their hand often, the fingernails grew so long that it started to dig into the palm of the hand and created an open sore. So please be mindful of that when you are assessing a patient who has contractures of the hands. Pay attention to those fingernails. Now you're going to assess the patient's groin and buttock. This can be a very uncomfortable part of the skin assessment for the patient, and sometimes maybe even for you. You just want to keep in mind that this is a part of your job, and it's very important that this assessment is done on this part of the body, these parts of the body, so that the patient does not develop any sores, or if they have a sore that's there that they may not know about, that it does not get worse. If you run across a patient who is uncomfortable with having this part of the assessment done, please just try to explain to them what I just stated, which was this is a part of the job and it's very important for their health for you to perform this assessment. However, of course, it is totally up to the patient if they want to allow you to do this part of the assessment. If they do not allow you to do this part of the assessment, you want to make sure that you document that the patient refused to have groin and buttock assessed. Now, moving on to the actual assessment of this area. You just want to look at the overall appearance of this area. Check the folds in between the groin and the leg to make sure that there aren't any rashes. That's the biggest thing to be concerned about in this area. However, I've also seen pressure ulcers in this area in patients who have catheters. So you want to be mindful of that and look for things like that. I've seen pressure ulcers on the labia as well as on the penis of patients. So always make sure that you look for that if the patient does have a Foley catheter. Next, you want to look at the buttock. You're going to look at the outside of the buttock. Just make sure there aren't any bruises, pressure ulcers, open areas, rashes, anything like that. You do have to look inside of the buttock. Just take a quick look because patients can develop rashes inside of the buttock. That is the biggest thing to look for in this area, rashes and pressure ulcers. So keep that in mind, and remember that pressure ulcers don't just come from pressure on a bed. It can also come from pressure of medical devices as well. While you're in the general area, you also want to make sure that you take a look at the patient hips. Look at each side of the hip and make sure that there is not any skin breakdown. Of course, in our patients who have limited mobility or no mobility at all. Last but not least, you are going to assess the patient's feet, heels, and toes. Look at the top of the foot and make sure that the patient does not have any wounds from maybe ill-fitting shoes that may be too small or too big and has rubbed the patient's foot. Also look at the bottom of the patient's foot. Sometimes I've seen wounds at the bottom of the foot. of patients who have stepped on something at home and may have gotten infected or just didn't heal properly, or maybe even new. So make sure that you assess the sole of the patient's foot. Next, you're going to want to check in between the toes. Make sure that there isn't any moisture. Some patients will collect moisture in this area, and just like the fingers, instead of it turning into a rash, it turns into an open sore. So you want to make sure that you assess that. Also assess the tops of the toes. Going back to the thing about patients having ill-fitting shoes, patients who wear shoes that are too small tend to create pressure ulcers on the tops of their toes. So be mindful of that and make sure that you are assessing for that. Next, you want to look at the heel of the patient's feet. You want to feel it to make sure that it is firm or decently firm. Any soft heels, even if there is no discoloration, should be documented, because that means that this patient is at risk for creating a pressure ulcer on the heel of their feet, even if they are mobile. So note that if the patient's heels are soft. Next, you want to look for any purple discoloration. Purple discoloration should always be documented, even if the heels are firm, because this could be the beginning sign of a suspected deep tissue injury. Some other things that you may see on the heels of the feet would be fluid-filled sacs that turn white around the rim, or purple or red around the rim of that sac. That is also a pressure ulcer and should be documented. Everyone gets pressure ulcers differently, and it can show up like this sometimes. So you want to make sure that you document that and initiate a treatment for the patient. So there you have it. That's how you perform a thorough skin assessment on your patient. I know it sounds like a lengthy process, but once you get in the routine of doing your skin assessment this way, you'll be able to do it just like that. And this way, you can make sure that you don't miss anything on your patient's skin and be held accountable for it later. Happy nursing.